How do you develop a community that doesn't actually know it's a community, has no meeting places, has no identity? What do you do? There was a chap called Tim Barnett who became the first CEO of Stonewall. And he was a councillor in Greenwich and he was openly gay. He wished to apply for funding for a lesbian and gay centre for the borough of Greenwich. Tim helped construct a funding proposal which was successful. The first thing, of course, was the post was advertised, and that went out through the council network, and myself, David Simpson, Jill King and Maggie Honey were appointed as 4 job share workers.
I went for the job interview. It was in Greenwich, in Haddow Street, I think, over a pub or next to a pub.
An upstairs office in a pub that was willing to have gay nights, and it was in the middle of Greenwich behind St Alphege.
My job was being in the office, talking on the phone to people would ring in. My art skills were used because I used to design posters, be involved in the newsletter, run the book club, did everything. It was very small. It was very, very small.
We were looking for premises. We looked at a few different places. And at the last, it was coming towards the end of our first year in post, and we hadn't found premises. And Bowater Road came up.
The centre was on an industrial estate in Charlton, and it was right next to the Thames Barrier. So I became an expert in the Thames Barrier. I could tell everybody what it was and how it worked.
The world's largest movable flood barrier, said to be the 8th wonder of the modern world.
But there was nothing going on there. It wasn't a centre like the London Lesbian and Gay Centre.
I have been asked, why on earth did you let yourself be put in a dark street down the back of an industrial estate in Charlton called Bowater Road? Why?
Some people felt a bit scared of it being down on an industrial estate, but other people felt more secure because they could go there and nobody'd know they'd gone there. Because quite a lot of the women weren't out to they weren't out to their family and friends.
You had to be determined. It was up a few flights of stairs. And I remember walking in and I was probably going to bottle it.
This was down in Bowater Road. It was on the 3rd floor. It was a brilliant place to go.
I remember, I don't know the name of the guy who worked there, just came and greeted me and invited me in and made me a cup of tea. And then I met lots of other people, some of whom I'm still in contact with.
And it was great. It was a brilliant, brilliant social area for LGBT people.
The most important thing I thought about the work we were doing was how did we support people in the community? And so primarily that was through the groups that we ran, because it was through the groups that we were giving people a safe space.
We would have really good discussions there, or just good fun nights, playing darts, billiards and stuff like that.
I mean, none of the people that came to the discos, the party sort of nights we had, would have gone uptown because they were living in Woolwich, and that would have been their first experience of going to somewhere socially.
There are a couple of pubs locally as well. There was the Gloucester in Greenwich, which was, a regular place to go.
I'd heard of a bar called the Gloucester, and I went looking for it around Greenwich, and I walked all around Greenwich, all around the park, and I saw this pub, and it looked like it was full of men. I mean, I didn't know, and I was very nervous. And I went in, and as soon as I got in there, I realised it was a gay bar, because the way everybody turned around and looked at you. All men. Yeah, so that was my first experience, and it was great. It was lovely. First of many. When I was in the 80s, when it was being advertised on the television, "Don't die of ignorance," the big tombstone, and it was one of the only things that frightened me at the time.
A friend of mine said, you just go for the test. You can go for this test for HTLV3. And I just thought, why not? I've only been out for a little while, and yeah, just go for it. I mean, what's the worst that can happen? It'll come back negative, right?
Yeah, I had to wait a week or longer, I think. 8 days, 7 or 8 days for the results. So I had that long wait just to get the result.
And I'd heard it's the worst 2 weeks of your life. You're just going to worry. It's going to be awful. And I didn't. I was like, yeah, whatever. Got a test, no, went off, because I didn't expect a positive result at all.
My name was called out. I was called into the room, and he said, "I'm afraid to tell you that you're HIV, and then you're positive." And then he just kept talking, but I didn't really focus much. You kind of go into a daze, like you've been hit.
So I got the news, it was shock. I remember being just absolutely thrown and just feeling like I was in a tunnel, just like tunnel vision, and I couldn't hear anything, just this like sound of waves, yeah?
I remember visiting a friend of mine who was poorly, and they put him in he had his own room, and that wasn't for positive reasons. Obviously, that was, you don't want anyone near you. So he had his own room, and I remember the door opening, and someone pushing a tray of food on the floor through and closed the door. And he explained that that's how they delivered his food. And he passed not long after that.
Nobody knew what was going on. And so, you were getting headlines like the gay plague. The community was in absolute panic and meltdown because we didn't know what was going on. This is before mass death, where we're still trying to get our head around it in this country.
Coming on in that same time as Clause 28, it just felt like nobody cared about us. Not really.
So we both kind of had a knowledge that HIV was a big issue, and we felt like health promotion, we knew, was doing some outreach work, and we felt like immediately there was an opportunity there. Why weren't we connected with them a bit more? That's, I think, how we got in touch with Mark McNestry.
When Sackett and Donna came in, it was just brilliant because, they brought kind of so much new energy and enthusiasm.
He was part of health promotion and doing HIV prevention, sexual health outreach with gay and bisexual men. And we met with him, and I think immediately we started talking about the opportunities to work together.
What happened in Greenwich was slightly in contrast to maybe what was happening in the centre of town, with gay men fighting AIDS. I think what we had was this real opportunity in this centre.
So Mike came in, and the idea was that they would develop the project and the thinking and the places to target and where metro-based services would happen, or the Greenwich Lesbian and Gay Centre-based services would happen.
So we took a very reflexive, responsive approach to try and understand the needs of men in the community. And that was both in terms of sex and behavioural change, but also how they socialised, what their networks were, where they had access to services.
We were doing outreach to public sex environments. Michael had a little yellow Mini, and I had a little blue Renault 5. And I think between them, we were lucky if we had like one of them working on any particular day. So we'd get in one of the cars and with loads of condoms and leaflets, and hang about in bushes on Blackheath and outside toilets in Charlton and in Greenwich.
And then we basically just really, in a quite flirty way, talk to as many people as we could, ask them about safer sex, ask them if they needed condoms, ask them if they knew about safer sex.
We were developing a way of working on the job, just kind of testing things out.
When we had the results of that year's worth of work, we were able then to apply for a full-scale project, HIV prevention project, based at the Lesbian and Gay Centre. What do we want to name an HIV prevention project that's really going to attract men, and it's quite sexy, but still gives the sense of what the project is about?
So we wanted to identify clearly that we were about sex and penetration, and thrust came out of that.
I remember laughing my head off when they said, "Oh, we're going to call it Metro Thrust."
So for me, kind of Metro Thrust was maybe kind of a bit too assertively masculine. But it was also very much in line with the messages around kind of what worked at the time, around being sex positive, and it did reflect the energy, the drive.
What the HIV prevention project showed is that we needed to go out there and talk to men as well. So it did increase the traffic, definitely, but what we didn't want to ignore was the trickle of need that was around mental health. So we started with the mental health service with the mental health drop-in.
You could come to the drop-in and one of us was available to offer one-to-one support, so you could always have somebody to talk to.
Lots of people feeling suicidal, and there's lots of anxiety and lots of long-term enduring mental health issues. They wanted support with different bits and pieces and help with accessing their GP or talking to their psychiatrist.
Like, people were really living with difficulties, and sexuality was, I think, the sexuality bit was actually where they were not being treated very well in services.
Feeling like they couldn't say where they'd been or talk about their partner or their families in a way that they felt free and able to, and that's because of the fear of a homophobic or transphobic response.
People tried to pull up sexuality as an issue as opposed to the rest of what their lives were presenting them with, and sexuality was there alongside it.
Over the years we've got bits of funding for different things in terms of providing advocacy and meeting the need from the people that were accessing it. It became, other than kind of a social gathering, there was 4 or 5 people, to now we have 50 people accessing every Thursday. So it's really kind of grown up. It's amazing, yeah.
We were also seeing young people coming through the door to our mental health services and through HIV prevention. So for us, it was about creating a place where we could let people grow up and be in their peer group and feel really safe.
The kids that were coming to the centre appeared to be dealing with a lot more than purely the issues around their sexuality.
we also knew from all of the national evidence and our experience of schools that there was a massive need for young people.
I volunteered for the youth group, and it used to be on Sunday afternoons on the high road, and a very very well organised, very well run and well structured group, and it felt like that we were sort of doing something pretty valuable for the kids.
Very soon after we started running the under-25s group, we realised that we needed an under-16s group.
The youngest, we had two young guys come in one day who were about 15. It was they were from Plumstead, and it just seemed like sort of the Beautiful Things film coming to life in a way. But it was wonderful to see how much younger kids had the confidence to come out.
And I remember attending one of our youth groups, you know, like you do sometimes, and like the kind of campness and carrying on that was just young people expressing their sexuality and being able to be free was amazing. It was lovely, it was joyful.
Me and Dax Ashworth used to share an office upstairs, and he was the manager of the Gay Men's Sexual Health Outreach Project.
So Jackie and I have worked together for many years, and she was working on the 50 plus work that we were doing, and that was her role. So I didn't really know her because that was a daytime job and mine was a nighttime job.
And I got to learn Dax's job just by sitting next to him, and when he left, there was no one to fill that role.
There came the fact that actually Jackie and I would go together and we would do that Gay Men's Outreach work together.
He would do most of the online work and database work and any IT things that needed happening, and I would be the forward-facing mouthpiece for everything. So I would be on the stage talking, and he would be the one dealing with all the money. And we were a very good team.
And then we just started doing, you know, what things could we possibly do that would encourage gay men so we could talk to them about, you know, safe sex and give out condoms and get people into the clinic. And so we would just think of weird and wonderful ideas and events. And one of the ones that I'd heard about previously that used to be done many years ago by Dax Ashworth and them, and I probably just started a conversation with Jackie about doing it again, and since then it's happened, which is the Pride boat that we do every year, which was taking just a group of probably about 120 odd gay residents up to Pride, up to Westminster Pier.
And we decided to make it a party, basically. They had a bar on board. They asked us whether we wanted that open or not, and we said absolutely. And I did the music because I am a DJ.
Our point at the time was to try and talk to as many gay men as we can, try and get them onto a mailing list so we could try and message them about future events that we'd have.
And during this time, and we would always embed this somewhere into any party we had, we would be doing surveys or doing education around sexual health with everybody on the boat.
The discussion wasn't just about how we're going to have a party and how we're going to celebrate and play, but also how do we include people who are marginalised within the LGBT community who might not feel supported at such an event.
That was one of the few spaces where actually what you got is a real mix of service users, volunteers, staff, everybody bunched in together.
That was brilliant to all be on that boat and just sailing up the river.
All arrived on the pier in Greenwich and piled onto this boat, and I have a feeling there was even a bus. It was the time where you started from near Charing Cross Station in terms of the Pride route.
And the youth groups used to love it, and they loved being in an open-top bus for possibly their first ever Pride when they were 16. It was really lovely to see how excited they would be.
I just remember it being great because there was a whole load of us from the centre went. Loads of women I knew from the centre went.
Being supported by hundreds and hundreds of LGBT people, I think to stand up and be counted, even if it's just for one day, it just allows people to just see how many LGBT people there actually are.
I was working with someone who had a horrific time in Uganda and lots of difficulties with the police there and abuse and all kinds of horrific things. When she came to Pride with us, she looked up and she could see the police marching in the parade. And she was like, Taz, there were gay police marching in the parade. That's incredible. And the tears that are coming down her face.
I spent the whole day crying, looking at this big quilt made up of all these AIDS quilts, thinking, you know, because I'd just been diagnosed myself, so it was very emotional Pride for me. I swore I was going to go to every Pride, and I did for a long time.
So there was always conversation, and still is always conversation about how people who might be experiencing mental health issues, or how young people who've never been to a Pride before, or how older people are going to traverse the whole route, and whether we need to provide alternative access for arrangements for people who can't walk that whole way. And that sort of goes to the core, I think, of who we are. There's a sort of care there about inclusion, which is, I've found really great.
Greenwich Lesbian and Gay Centre got a foot in the door. From that, moved to Greenwich High Road, wondered why we had ever chosen Bowater Road, found out why, and then moved into being a wider based project, but at which there would be a hub. Its hub was Greenwich Lesbian and Gay Centre.
I'm really proud that it still exists, that there must have been something in what we did that still has value and still speaks to both funders and to the people who are using it.
It certainly felt for us that we were creating something, a community. And I think that's borne out by the fact that there are people who are still connecting and, talk about the Metro as being really important to them.
It changed people's lives that came there. It was definitely something very positive.
The fact that, in a sense, we did ensure that a community was represent a marginalised community, and that community has then been able to just kind of, grow and thrive.
I was one of many, many people walking for change, but we did make a difference. And I'm proud of the difference we made.